Nice to be
So,
here.
before we get started, I want to just explain to people, and I know the answer, but for those of you, there may be some people who are recently don't really understand what exactly are uterine fibroids.
Well, fibroids are the most common pelvic tumor seen in women. So they're benign, not cancerous. Um, and while they're benign, they can cause a lot of misery in a lot of women. It's very prevalent in adult women, often in their 30s and 40s, but it can affect women in their 20s, even rarely teenagers. And while it's a problem potentially for all women, it is a particularly prevalent issue for African American women. They get them earlier in life, they get them bigger, more numerous, and unfortunately, they're more likely to get hysterectomy than other racial groups, which we
So
can
I'm
talk
glad
about.
you actually brought that up. That you and I have had a conversation about this before. Very transparent. And again, you all feel free if you have a question or a comment, put it inside the question bubble at the bottom. The word bubble with the question mark, put it there so we don't inadvertently overlook it. And again, please send this to all your friends, family, your girlfriend, your husband, or whatever, because this conversation is going to be very, very helpful. So as a Black woman, and Dr. Lipman, you and I have had this conversation before, I will admit for myself, and I know several others who are hesitant to go to a doctor who does not look like us. We're hesitant to go to a Black doctor, to a white doctor. And this was actually not going to be one of my questions during this conversation, but let's just talk about how do you address that? How do you handle that? Because we are.
I have a long legacy of caring for women. My practice is 90% African American women, so clearly they trust me with their care. I've been practicing here in Atlanta over 30 years, the last 25 of which exclusively treating fibroids. That's what I do. That's my life's work. So while, yes, I'm not an African American physician, but I have extensive knowledge about caring for women with fibroids, and women appreciate my expertise. I've seen women from every continent on the globe except for Antarctica. People have traveled pre-COVID. We would see people Africa, the Caribbean, Australia, even Hawaii. People come from great distances for my expertise. So clearly, my work and my care of patients resonates whether I'm African American or not. I also spend a lot of time in our community, and it's our community. It's not a white community or a Black community. It's our community, and people can see the efforts because I serve primarily African American women, so a lot of my work is in the African American community, and it's purposeful, it's directed, it's purposeful, and I'm trying to do the best I can and make as much of an impact as I possibly can with what I have available.
Thank you for that, because I know that question comes up quite frequently. In full transparency, and again, you and I have talked about this. I've gone. Those of you who follow me, you probably heard my story. I've had, I think, 4 second opinions, 4 opinions before I did eventually decide to move forward with my final decision. And for the record, guys, full transparency, I did have UFE. I'm not here to promote UFE versus anything else, or not promote it. It's just my goal to try to bring all options to everyone, whether it's a nutritional, holistic perspective, minimally invasive, etc. Let's kind of take a step back, because you talked about how, you've been doing this for a long time. It's your legacy. How did you get into this? Like, did you go to school to say, you know what, I want to help women with uterine fibroids? Like, did you just kind of fall into it after becoming a medical doctor? How did you get into this profession?
Well, I believe, things happen for a reason. I believe in the fate, and God put me in places. It's how I met my wife by, quote, accident. It's how I got involved in fibroids. And UFE actually was discovered by accident. Interventional radiologists have been embolizing tumors for a long time. Usually it was for cancer, and that's how I got started, embolizing cancerous tumors to make it an easier operation for the patient and for the surgeon, basically cutting off the blood supply to these cancerous tumors for a quicker operation. And someone in France back in the early 90s, an interventional radiologist by the name of Ravina, got the bright idea, well, fibroids are very, very vascular tumors. And so even though they are not cancerous, why don't we embolize these tumors prior to hysterectomy to make it an easier surgery? And it made sense. So he started doing that, and the healthcare system in France is socialized medicine. So it's very rationed healthcare. You don't have the same access to care as you do in the United States. And so you have to wait for your elective procedure. You can't just, like when we do an embolization in this country for cancer, let's say, they are embolized, and then an hour later, they're in the operating room getting their cancer operated on. Not in France with the rationed healthcare, socialized medicine. So these women were getting embolized and then getting sent home, and they would wait for their elective hysterectomy. And that would be 6 weeks later, 7 weeks later, 8 weeks later, and they were waiting. What happened while they were waiting at home? Their symptoms went away. So these women would call their gynecologist and say, you know, I feel great. My periods are normal now. I don't have any pain. I don't have any urinary frequency. Do I still need that hysterectomy? Because I feel great. And the answer was no. You don't have to have that second part. You can just be embolized and take care of your fibroid problem. And so the gynecologist that was working with Dr. Ravina, his close friend was the chief of OB-GYN at UCLA. And he said, you better look at this. This is pretty exciting stuff. And so he got his interventional chief of radiology, Scott Goodwin, to do the first UFE in the United States back in the mid to late 90s. And it was published soon thereafter, the first 11 cases. And Scott was presenting his data on the first 11 UFE patients in the country. And I was at that same conference presenting on cancerous embolization. And normally, I don't go to that conference. It's a general radiology conference, but I was invited to give my talk, a brief on what I was doing. And so I decided to go, even though I never attend this conference regularly. And then normally when I give a talk, usually you give your talk and then you leave. But this auditorium probably had enough seats for like 1,000, 1,500, maybe even 2,000 people. It was huge. And there were about 10 or 15 people in the audience. So I felt bad. As soon as I gave my talk, I sat down in the audience so the other speakers at least would have some warm bodies to look at. And so again, Scott gave his talk about 3 people after mine, and the light bulb went off. It's like, I'm in Atlanta, I'm doing embolizations. This sounds amazing. I could do a lot of great work. And so, you know, I was there, quote, by accident, but I don't believe in accidents. I think God put me there for a reason. It's become my life's work. And I've never looked back. And I've done close to 10,000 UFEs now. I have the largest UFE experience worldwide, so they tell me. And it's been an amazing career. I've helped, say, close to 10,000 women avoid major surgery and give them their life back. It's transformational. It's what keeps me coming to work every day. I love coming to the Atlanta Fibroid Center. It's a labor of love. I'm blessed to work with outstanding nurses and techs and staff. I'm sure Dr. Weaver can chime in on that. She was with us for a while and was a great help to us. And it's a wonderful place to work. And I wish more people knew about UFE, because we could help so many more, and other interventionalists across the country, like myself, could help thousands and thousands of more women if they only knew about it. Nobody truly wants a hysterectomy, but they don't know about UFE. They're not given any other option. It's one option only. And that's really sad. They're entitled to know
So you
all the
talked about
options.
a lot of stuff just now, and thank you for that response. I didn't realize that's how you got into doing UFE. But when you talked about you used to embolize cancer tumors, interestingly enough, one of our best friends, he's been diagnosed with pancreatic cancer. He just had a procedure. I forget the name of the procedure. You probably know it, but his wife explained that it's literally almost like getting UFE, embolizing the actual cancer. So I kind of like that that commonality there, but I do want to just comment on your statement about socialized medicine. A lot of people don't realize I'm an insurance agent, a broker. I've been doing insurance. I negotiate business-to-business contracts with major insurance carriers, Blue Cross, United Healthcare, Cigna, all the ones that you guys use, right? I
Right.
know for a fact, I've been doing this for 23 years, and I know for a fact that socialized medicine, while people might want it, to your point, there are people on these waiting lists who end up dying because so
Yep.
while you may want socialized medicine, I always tell people be a little bit careful about that. I know it's a conversation,
Yeah.
but I'm
Yeah.
going to go to the comments here. Then I'm going to come back to you with a couple of questions. Well, first I see just some comments, not even questions, but I'm going to try to go back. Okay, Kim Crawford, 1411 says, Dr. Lipman is the best. My surgery went awesome. It's been 5 years now, and getting UFE was the best decision I've ever made. Someone said, Kisham Creation of the Mint says, my doctor was white too. Love it. Okay, Forever Thief. I don't know if I pronounced that right, but don't hesitate. Dr. Lipman and his staff treated me like gold. I had the same concern, and I was on AA who tried to give me a myomectomy. I'm so glad I found Dr. Lipman. I felt so cared for. Dr. Lipman for helping me. He's the
Well,
truth.
that's great.
Let me go to an actual question here. So Kisham, and again, if I'm pronouncing your name wrong, I apologize. Kisham, creator of the Mint, says, how do you navigate around the bread and butter of the OB-GYN? Many will not suggest UFE.
Right. Even though the UFE procedure is well proven, safe, effective, it's published in all of their literature, so they can't say they don't know about it. All the gynecologists know about it, but most, unfortunately, don't mention it as an option, and that's wrong. They need to. They're obligated to mention it. Some do, but the vast majority do not. And it's really sad. I mean, here's a group of physicians that went into gynecology, obstetrics and gynecology, I presume to help women.
Right.
Why else would you become a gynecologist if not because your calling is to help women? Well, I have one of the biggest helps for women of all time. I would put it up there in terms of significance with the pap smear and the mammogram. And yet you knowingly don't mention it. I mean, I don't know how you
It's
sleep at night.
interesting that you
really
say
don't.
that, because my personal experience, as you all may know, I was going to my OB-GYN for 12 and a half years. And I always say that half because it was 12 and a half years. And I felt that I had an amazing relationship with her. And similar to your situation, I was diagnosed with having fibroids by mistake. I was going to get my UFE replaced and they couldn't find it, so they sent me to ultrasound within her same office visit practice. So this is all within, we're saying, like hour and a half doctor visit. And the ultrasound tech found the fibroids. And when I was leaving, well, she found the IUD and she goes, oh, the IUD's right there. By the way, how your fibroids come along? And I go, what's that? And she's like, I'll let the doctor talk to you. And I get back in there with the doctor and she's just going over everything. Okay, perfect. We were able to locate the IUD. Let's bring you back next week. Too much time has passed. And I go, hold on, step back. Can we talk about that fibroid, those fibroid things? So to your point, I have learned from my personal experience, as well as talking to several other women, that their doctors are not recommending alternative options. Speaking of alternative options, what's your take when it comes to nutrition? What do you feel about that?
Oh, I think it's very important. It's I'm in a sense I'm a mechanic, and the patient has an automobile, and the health of your automobile
Mhm.
is dependent on what kind of fuel you're putting in it, and are you, getting the appropriate maintenance, the appropriate checkups. And so, unfortunately, many people, by the time they get to me,
Mhm.
the car is broken and I need to fix it. And that's with UFE. But if you spend time on the preventative side, and we talk about it, particularly in women that don't have significant, horrible symptoms when they get to me, but maybe their symptoms are either they have fibroids and no
Mhm.
symptoms or fibroids and mild symptoms. We spend a lot of time talking about
Mhm.
lifestyle modifications. You know,
Mhm.
we don't know where fibroids come from, but once they arrive, they grow with estrogen. And estrogen is
Mhm.
produced and stored in body fat. It's one of the reasons why African American women
Mhm.
disproportionately suffer with fibroids, because they have more
Mhm.
body fat in general than other racial groups. And so we talk about, every woman knows what their
Mhm.
ideal body weight should be. Try to, through healthy eating, exercise, lose that excess body fat, really try to get
Mhm.
closer to your ideal body weight. It'll
Mhm.
be great for your fibroid health. It'll also be great
Mhm.
for your cardiovascular overall health. We also talk about vitamin D. If you have a normal vitamin D, you are pretty
Mhm.
unlikely to suffer with fibroids. However, only 10% of African American men or women
Mhm.
have adequate vitamin D. And so that's another piece of this puzzle that we talk about, getting your vitamin D checked, making sure your levels are good. And so there are a number of things we can do. We can, eat healthier. We can exercise, lose body fat, check our vitamin D. And there are things that we have no control over, like the genetics. You can't pick your parents. Genetically, fibroids run stronger in African American
Mhm.
families. You can't do anything about that. But the other stuff you can do. So there are things you can do, and there are things that are out of your control. And we talk to patients about the things that they can have some control over. But when it, gets too far along and the car is broken, and their symptoms are very significant, these lifestyle modifications can be helpful after the UFE, but
Mhm.
they need something done, soon, to
Right.
kind of get them
So I
back
want to
on the
comment on
path.
something. There's two things I want to comment on. Number one, everybody here, remember, let us know where you all are watching from. Again, we're having a fireside chat with Dr. Lipman of the Atlanta Fibroid Center. Click that kite, the triangle looking thing at the bottom of your screen. Send this IG live to everyone. And yes, this IG live will be saved in my reels, my stories, whatever it's called, but it will be saved in my videos. Dr. Lipman, I want to go to you said something a second ago, and I don't want everybody to get on this whole let's attack Dr. Lipman thing, because I'll probably get a couple DMs about this. So you talked about body fat in Black women. Let's just be honest, y'all. We are hippie. We got hips, we got butt, we got boobs. So that does play a significant part. I want to make sure I mention this, Dr. Lipman, because I don't want to just kind of let the conversation go without addressing it, because I will probably get some DMs. But when he says that Black women are more likely to develop fibroids because of part of the reason because of our BMI and our weight, that's, I mean, it's just facts. We are thicker, right? So, secondly, you mentioned that with genetics, you can't do anything about it. That's very true. I know several people who have been vegan, not gone vegan, but who have been vegan all of their life. This one lady in particular, she's actually a dancer. She probably has like 0% body fat. She's Black. She's a
Right.
dancer, and she's been vegan, and she developed fibroids. Right. So.
Right. I see a number of women in my
Mhm.
practice that are African American that
Mhm.
have very low body fat
Mhm.
and very big fibroids. And so, unfortunately, as I say, the fibroids grow with estrogen stimulation, exogenous estrogen. And estrogen is in the water, it's in the food. There's even doing the healthiest things, eating well, exercising, doing all the things, normal vitamin D, doing all the things that you could do. There
Mhm.
is still this genetic component that you can't do anything about. And so you try to do
Mhm.
the very best you can do. But if you're still suffering with fibroids, fortunately, we have UFE, and that can really, you know, give you your life back without any surgery whatsoever.
So giving your life back. Again, guys, I have been very transparent in admitting that Dr. Lipman's office did perform my UFE. I don't have him on his IG Live because he did it. I have him on his IG Live because I want to bring resources to you all. Good, bad, ugly, minimally invasive, non-invasive, holistic route, major surgery, whatever. My goal is to make sure that you all are equipped with as much information as you need. And that's what I stand on. But I want to go to a question here. Looks like Keisha M is asking, well, she says, many people ask me about getting pregnant. I'm done having kids. I'm 50, but what is your opinion? Which is, thank you for mentioning that, Keisha. That's actually one of my questions. Let's talk about uterine fibroid embolization and pregnancy.
Yeah. It's very realistic possibility. I mean, we've had numerous children born after UFE. I've had multiple sets of twin births, and unlike women that undergo myomectomy, which is the surgical option for fibroids for women that have an interest in fertility, unlike myomectomy patients, our patients typically have full-term vaginal deliveries, whereas if you have a myomectomy, they will not let you have a vaginal birth. No how, no way. More surgery. In fact, those are the two most common surgeries done in the United States, C-section #1 and hysterectomy #2. And we've got to put an end to that. I hear all the time, oh, well, my doctor said if I'm still interested in children, I can't have UFE. That's one of many myths about UFE. Your fibroids, my fibroids are too big for UFE. Another myth. I have too many fibroids. My doctor said I have too many. Myth. My doctor said if I have UFE, I'll still get a hysterectomy anyway. Myth. There are so much mis or disinformation about UFE. It's really sad. We've had numerous children, but you can't, every patient is different. Some women have a few small fibroids, and some people have lots of small fibroids. Some have a few big fibroids. Some have both big and small. So, you know, ultrasound dramatically underestimates a fibroid burden. And that's why it's so important to two things. One, make sure you get a pelvic MRI and not settle for ultrasound. Ultrasound is a low budget, poor man's awful resolution of your pelvis. MRI is the best gold standard to know exactly how big, how many fibroids you have, because that's really important, particularly if you're interested in myomectomy or, you know, you're having fertility, because if you have a gazillion fibroids in your uterus, a lot of women say, well, I know I have 3 fibroids. My doctor's been watching them on ultrasound. I have 3. When we get the MRI and there's 20 or 30 or 40, that makes a big difference because surgeons can't take that many fibroids out. They can get out 10 or 15. That's a lot. But a lot of women have way more than that. So they undergo this major operation which risks hysterectomy. Remember that. Every myomectomy patient has to sign a medical waiver saying, you understand that we're going in for myomectomy, but you could wake up with hysterectomy. But the biggest Achilles heel of myomectomy is that they can't surgically typically get them all out. And so a woman will wake up with a lot of living fibroids in their uterus right after surgery, and those fibroids start growing, and there's an 11% per year rate of recurrence for myomectomy. That means over half the women will need something within 5 years, a third of women within 3 years. And I've seen women 6 months post-myomectomy or a year post-myomectomy, and they're seeing me now because their symptoms have returned. Why? Because the fibroid, there are a lot of living fibroids that start growing, and they go back to their gynecologist and they go, my symptoms, I've got my symptoms again. And they go, those darn fibroids, they're back. And that's a white lie. That's a lie. They're not back. It's the ones you, the surgeon, didn't take out the first time. They leave them with this impression that they take them all out.
That.
They don't.
So with UFE, can fibroids grow back after having uterine fibroid embolization?
They can, but the rate of recurrence for UFE is way lower because there's so many. I mean, you say you wake up from surgery, you have living fibroids already. all they have to do is grow. With UFE, typically, all the fibroids are dead. So when a UFE patient wakes up from UFE, all of her fibroids are dead. So those, you'd have to, whatever, nobody knows where fibroids come from, but whatever that trigger is, would have to trigger growth of a new fibroid. Then it would have to grow to a size cause symptoms. That takes years. So for most women, particularly if they're in their 40s when they have a UFE, it's a one and done. For myomectomy, it's commonly 2s and 3s. I've seen as many as 5. I think that's criminal. But in my opinion, no one should ever have more than one myomectomy. You can have one, but anybody that has a myomectomy, the next go round should be UFE, because otherwise you're setting that woman up for procedure number 3. It's terrible. And every time you cut on that uterus, the fertility drops dramatically. So the fertility rate after UFE is every bit as good as it is for myomectomy, but we get the benefit of having a non-surgical procedure that doesn't put your uterus at risk and knocks out all your fibroids.
Okay, thank you for that. So for the record, they can grow back, people. However, as Dr. Lipman mentioned, implementing, nutrition, making sure that you're eating well, exercising, doing whatever you physically, mentally can to try to help minimize or lessen the opportunity for the fibroids to grow back is very, very critical. So there was a question that someone sent over to me. So yeah, they can grow back, but just make sure that you're doing all that you can. So we're going to go to another question again. So time out. Pause for one quick second. Everybody who's watching, 2 things. Number 1, tell me where you guys are watching in from, listening from. I always like to know my audience is. Secondly, click that kite, that triangle kite looking thing. I don't know what it's called, but click it so you can send this video and this live to all your friends, your family. Send it to your boyfriend, your husband, your uncle, your auntie, because everyone involved in your life, your family members, your children, your spouse, they need to understand what you are going through. So lastly, and we're going to continue on, 2 things. Yes, this is going to be saved in my on my profile, in my videos on IG. Lastly, we are doing our 2nd annual Run FAR 5K. FAR is an acronym for Fibroid Awareness and Resources. It is a 2-day event during Fibroid Awareness Month, which is in July. So on Friday, July 14th is going to be the Fibroid Brunch, which is a panel discussion of more than 10 experts in the women's reproductive, womb wellness, fibroid realm as a whole. And then we do have someone from Dr. Lipman's office attending that panel discussion. Second, day 2 is on Saturday, July 15th. It is going to be the Run FAR 5K, 2nd annual. We did the first one in the middle of the pandemic, and Dr. Lipman's office was sponsored. They were there. He and I actually just went off and went on our own little tangent, had like a 35-40-minute conversation afterwards. Didn't even mean it, but it was just organic. So again, click the kite, invite your friends, follow Dr. Lipman. Make sure you click the link in my bio to register for the Fibroid Brunch and Run FAR 5K. Now we're going to go to another question. From Keisha Moore. Hey, Keisha. Do you offer a pelvic block with your UFE, pain management?
We don't. I haven't found it to be necessary. I mean, there are a lot of places that don't have a specific pain regimen in place, and they tend to have a little bit more of the post-procedural pain issues than we do. Certainly getting a block is fine. It's helpful. It does add extra time, extra cost, and some extra risk. You have to be careful about the block in that you have to make sure that you're not in a vessel when you block, because that can cause serious neurologic and cardiac events. So there is some minimal risk to it. It can be, it has to be very properly performed and careful, but it does work well. I did a few blocks just to see for myself, but it added a lot more time to the procedure, and I just don't think for us, it didn't make sense, but it's perfectly fine to have a block, and it does help with pain afterwards. But we have a specific pain protocol that we've been modifying over the years, getting better and better at it, and really trying to improve the post-procedural pain. People will get pain afterwards, but the number of patients that have a significant amount of post-procedural pain is really lessening, and that's great. It's not zero. We still see it, but fortunately, patients are nearby that have the procedure. They can come back to the center for additional pain medicine if needed, but fortunately, it doesn't come up very often, but it's there.
You know, it's interesting that she listed that question, but I didn't have a block when I had my procedure done. Dr. Lipman's office was very clear on setting expectations on what to expect. And Dr. Lipman, I told you this before, not to be rude, but I was almost hoping that your office failed me because I was afraid, because in all transparency, like I said earlier, I was afraid to go to a white doctor because of the medical disparities. But when I went, and guys, I don't have anything negative to say at doctor at all. They hit the nail on the head. I think I saw someone in here said they felt like VIP. I did as well. I have to be very honest with you. Again, not trying to promote UFE, but I just want to make sure you guys are aware of all your options. And I felt like I was home. It was very comforting for me. I never at any moment did I feel weird or uncomfortable. You guys got it down to a T. You do. All right, next question.
Well, just to respond to that, I've been practicing over 30 years now in Atlanta, and one thing that has never ever failed me in my over 30 years of practicing medicine is I treat every patient like they're my wife, my mom, my sister, my daughter, and that just doesn't fail. And our center was specifically designed for women. We talked to a lot of women, particularly women of color, because that's who we predominantly serve, about what are your expectations? What would you like to see in your healthcare experience? And so, I had some preconceived notions. I thought, well, number one's going to be, expertise and quality, that sort of thing. Actually, it wasn't. It was kind of that was on the list, but it wasn't number one. Number one was privacy. And so when we designed the center, instead of the typical thing that you'll see in most outpatient centers, in fact, I had a colonoscopy recently. This was what I experienced. It's like they have this recovery corral with these little flimsy sheets in between the gurneys. And, there was men, there was women. They had one type of gown, and it was not for a 6'4" gentleman like myself. It was for like a 5'6" person. And I was coming out of my gown, and the woman next to me, she probably weighed about 250, 300 pounds. It wasn't made for her either. She was coming out of her gown. We looked at each other and go, we should be married, because there's no secrets here. And that's what we didn't want at our center. Every woman has their own private room. And so they have their own nurse. And it's a completely different experience than what I experienced at the hospital where I just went. And it's unlike experiences that anybody gets in healthcare. I've had numerous patients say, Doc, I felt like I was at the Four Seasons. I've never had such an experience in a healthcare environment. It's awesome. And that's purposeful. That's, again,
and
what we want to accomplish
you say
every
that.
time.
Everything he's saying, guys, is 100% true. My question I was going to ask, but you just answered it. I was going to ask because there are several other UFE doctors out here. What separates you from someone else? And you just said it, 30 years experience. And when you come to your facility, you feel like you have privacy, which is 100% true. Let's go to another question here. So I have a question from I believe you pronounce it the Black Orchid. Are there risks for developing an embolism? Oh, that's really good. Is there risks for developing an embolism after this procedure?
Any procedure that you do has the risk. It's called a DVT, a deep vein thrombosis. It's a clot that originates in a patient's leg, typically, although it can also originate in the pelvis. And in the leg, it can cause leg swelling. If it travels, it can go to the lungs and cause what's called a pulmonary embolus. And so any procedure that is done has a risk to it, but the risk of getting a DVT or even a PE after UFE is way lower than a surgery. And the reason why that is that the risk is significant the longer you're not moving. If you're sedentary and not moving, that is a risk for blood clots. So some of the other risks are if you're significantly overweight, obese or morbidly obese, because again, you're typically sedentary, you're not moving a lot. If you're on birth control pills or any other hormones of any kind add risk, and you could develop a DVT. And so there are a number of other risks, less common, but any procedure has the potential. But fortunately, with UFE in my hands, our procedure times are 20 to 30 minutes. It's very quick, versus surgery, where surgery could take hours. And then after surgery, they're laid up for hours, sometimes days. Our patients, they're walking around within 2 hours after the procedure, and they leave the same day with a Band-Aid. So their time to ambulation is much, much quicker than surgery, where there really is, you know, in patients that are significantly overweight, or if they smoke, or if they're on birth control, they have a significant risk for DVT in that population. And oftentimes surgeons will put stockings on people, and, you know, these automatic compression devices, and might give them blood thinners, you know, and so forth, and do things to try to make sure their blood doesn't clot. But we don't have to do any of that.
The reason why I
UFE.
laughed after you said that about the time it takes about 30 minutes, I laughed because when I have a procedure done, I think when I was in the recovery room, I think I said something to the effect of, like, are we going to get started? Like, have we started? And you guys were already done. Yeah, I didn't. It's not surgery, guys. There was no incision. I didn't have stitches. It was literally a Band-Aid. And with me, because my lifestyle, I try to eat as clean as possible. I'm not vegan or anything like that, but I don't eat fried foods, no red meat. I'll steal a French fry from my husband's plate every now and then, right? Minimal, very, 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 very little to no dairy, I've eaten red meat since I was, I don't know, since 97. Yeah, 1997. I haven't eaten pork willingly or knowingly since I was 16, since my son's father grabbed my ham sandwich and threw it out the window. But what I'm making is that, you know, I feel that I was rather fit, right? Physically, mentally fit. And so when I had it done, I was back on my feet in no time. I mean, I would say I was able to walk around the same day, but I kind of laid because I was a little bit scared, to be honest with you, because one thing your office did do, again, I said, you got it right. And again, guys, I'm not trying to promote Dr. Lipman's office. This is not a commercial for them. I'm just telling you my experience, and I will always stay true to my experience. You guys just got it right. And I mean, you did. And your staff, I forget her name. It starts with is it Gertrude? Did I get that name right? Some name, but she was amazing. Anyway, the point I'm making is that I was back on my feet in about maybe 2 days, walking around. My girlfriends came to cheer me up because I was kind of scared. But I mean, I was probably back at the gym doing boot camps. Maybe I try to lay low, maybe 3 weeks, two. But I mean, I probably should not have been doing that. But I mean, I felt like I was fine.
Yeah. By 3 weeks, there's no restriction at all. Even 2 weeks is no restriction. We want people to avoid heavy working out for 2 weeks, but once you hit the 2 week mark, you know, the restrictions are off.
I think this is a medical provider. If I'm not pronouncing it correct, I do apologize. Sumi Bal, MD. I did see the comments. I didn't see, oh, here's a question here. Again, guys, as a reminder, if you have a question, put it in the question box. I don't want to inadvertently overlook someone's question. Do you go through the groin, both groins, or the wrist?
We go from the right groin. Just the only place in the country that does both groins, and it really doesn't make any sense to me, is Georgetown. They do a bilateral femoral approach, but that just gives an extra wound. So that doesn't make it. That's never made any sense to me. and the right groin is our approach. The wrist has really, in my opinion, no business in UFE. It's an important access, site for cardiac work, cardiac intervention, pulmonary work, upper GI work perhaps, but not for fibroids. It's much farther away from the target, and it's just not necessary. The radial artery in the wrist is, in some women, not even 2 millimeters in diameter. And the little straw that we put in to the artery is about 2 millimeters. So there's a risk for clot development around the little straw and in the arteries of the hand and wrist. You have to give a special, cocktail into the, for people that are going radial, just to try to make sure that you don't have vascular spasm or blood clot formation. You use an anticoagulant. And then there's also a risk on the way you go the left wrist, because there's less vessels to the head and brain on the left than the right. But you still have to go by one of those vessels, which is called the left vertebral artery. And there have been, on unusual rare circumstances, there have been strokes reported after UFE from a radial approach. So it adds some risk, and there's no benefit to the patient. So we don't do radial approach. It's all femoral. The femoral artery is several times bigger than a radial artery. There's no worry about blood clots ever. You don't have to give a special cocktail. You don't have to give any anticoagulants. It's a very safe approach, which is close by the target. So radial for UFE makes absolutely no sense. It makes sense for other IR procedures and other cardiology, interventional cardiology procedures. It makes no sense for UFE.
Actually, I learned something new every conversation I have. I never knew that there was even such thing as bilateral, which is really kind of interesting to me. But
yeah, they do bilateral and they crisscross the catheters. It's silly. You only need one approach. You can get both sides from a right femoral approach.
Good question. That was very medical. Okay, the question.
Very medical.
Did you lose weight dramatically from the stomach area? I think that's probably pointing to me. My pumpkin 18. So what I will say, oops. Oh, I thought I closed out. Oof, that was close. I did. In full transparency, again, my largest fibroids, if I recall correctly, probably pull my medical records, were 11 centimeters and I think 7. So they were fairly large. Your office was very transparent in saying I will be lucky if I get 50% shrinkage. I'm assuming because of location size, whatever. I did get 50% shrinkage. I no longer was, I could wear my crop top shirts. I was no longer scheduling my vacations around my period. I was no longer doing my girls' day out around my period, and I was able to have fun with my husband, and it was actually pleasurable this time. So yes, I don't know how many pounds I lost. I have no idea. I didn't measure that. But what I did do is measure the way that I felt physically, how I felt mentally, emotionally. I felt like I was really able to reconnect with my friends and my family and my husband. And most importantly, I just felt really good about myself. People weren't asking me, am I pregnant anymore, right? I didn't have that issue. I didn't have the anxiety of worrying about if I was going to have an accident anymore, because I was suffering in silence. I was doing a whole silent suffering thing, which that's a different conversation. But you guys know when you carry an extra pair of clothes with you because you're afraid you're going to have an accident, when you triple up, double up, and still have an accident, or just different things. Hey, Joy. Happy to see you both, and this is an important conversation. Thank you, honey. So she does the Plus Strut. Amazing event, the Plus Strut. Look on Instagram. It's either, I think it's Plus Strut or the Plus Strut. Feel free to put the comments here, Joy. But it's I believe it's a 5K for overweight, plus size women, and her event is amazing. So I'm going to go to another question here. Then I'm going to continue the conversation with Dr. Lipman. You guys are doing amazing, and Miss Morgan, thank you for sharing your journey. Absolutely, I'm very transparent. And I want to make sure that oh, here's one here, which I think you just probably addressed that. British 444 asks about risks. I think you kind of just addressed that one.
Yeah, well, there are some women that don't menstruate after UFE. So we ask patients about their desire for fertility. Now, fortunately, in the roughly 10,000 women I've treated in the past 25 years, I've never seen anyone under the age of 40 that didn't have a menstrual afterwards. So it's only for women above 40. And even 40 to 45, which is the next category, it's 1 to 2%. 46 to 49, about 5 to 10%. But usually by 46 to 49, the vast majority of people are not interested in fertility any longer. But even in that age group, it's low. So that's one risk. We talked about the very rare DVT risk for some patients. There's about 5% of women that will temporarily pass some fibroid material vaginally. It's totally fine, and it usually lasts for a cycle, maybe 2 cycles, and they see this stuff that's not blood or blood clots, it's fleshy like tissue, and it's totally fine. It's just important to know so a woman doesn't freak out, because most women have never seen this stuff before. Some have, but most have not seen this. And so we want to tell them, you might see it, 5% chance. If you see it, 2 things. One, it's nothing worrisome. That we explain what it is, totally fine, no worries. And second, leave it alone. Don't try to flush it out or douche or anything. Just let it go like the rest of the menstrual.
I think I did see some particles of the fibroid expel when I had my menstrual cycle. I'm quite sure I did. And but I mean, again, you guys told me what to expect, so I wasn't surprised. I wasn't afraid. It was just part of the whole process. And again, full transparency, guys, my periods went from 9 days, about 9 days, where I was tripling up. I would have I don't even wear tampons now, but I never really liked them. But I would do a supersized tampon, an overnight pad, which is like a diaper, a pair of, actually quadruple up, full supersized tampon, overnight pad, a pair of absorbent underwear, a pair of shorts, spandex shorts to kind of keep it all tight. And then I wear like my outer clothes, whether a pair of pants or a dress or a skirt. And a lot of people had no idea what I was going through. And I went through that for a couple years. And it's scary. After I had UFE, probably 2 cycles, my cycles were bad, but I wasn't afraid, because again, your office prepared me, so I knew what to expect. About, I think maybe my 3rd cycle, that's when it started getting a lot better. Every single month after that, it has gotten better. So I've had for those of you who are joining, I had my UFE procedure in 2019, April of 2019. And my periods, once everything kind of leveled out, my periods went from 9 days to about 3.5, 4 days. And I mean, now, well, I'm kind of older now, much older now. So they probably last like 3 days, 2.5 days, 3 days. But yeah, I mean, it was an amazing experience. I said, again, I no longer schedule my vacations around my period, schedule my girls' night out. I don't have that anxiety of, if I go and hang out with somebody, am I going to have an accident in their car or whatever, or meeting. So again, thank you so much, my friend Joy. You're too kind. Thanks for that. So yes, she has an event called the Plus Drive. It's the first 5K for plus size women. So go and check her out. Follow her.
Yeah, it's a great event. We've participated in the past.
It's an amazing event.
Yeah,
Actually, to be fully
event.
transparent, I'm glad you joined us, Joy, if you're still with us. But she was one of the several people I talked to when I came up with the idea to have a 5K run walk. She actually met me at a Starbucks in Midtown, which I still probably owe you some coffee. Well, I picked her brain for probably nearly 2 hours, and she didn't hold back anything. And one thing you told me, Joy, and I'll never forget, and I think I told you, but if I didn't, I'm going to tell you now. One thing you told me was to make sure I pay attention to everything, make sure I understand what's going on in every aspect of my event. So thank you so much for that. I really appreciate it. And again, for those of you who are joining us, a couple things really quickly. That kite triangle thing, shoot that out to your friends, let them come on and join us, send it to your friends, your family, your boyfriend, your spouse, your kids, whatever, your girlfriend. Secondly, you do see, click the thing at the top, link in the bio, follow Dr. Lipman's office. He is with the Atlanta Fibroid Center here in Atlanta. He's been doing this for over 25, 30 years. I am planning our second annual Run Far 5K. FAR is an acronym for Fibroid Awareness and Resources. It's a 2-day event during Fibroid Awareness Month, which is in July. So on Friday, July 14th, is going to be a panel discussion called the Fibroid Brunch. Dr. Lipman's office is going to be there as a panelist. We're gonna have over 10 experts in women's reproductive fibroid space. And then on day 2 is going to be the actual 5K run walk, which is a family-friendly event. It doesn't matter your fitness level. All are welcome. So definitely feel free to click the link in my bio. And I would love for you all to join us. I see a question right here from Cassie Marie, 1971. Can fibroids go away with diet? We kind of touched on that a little bit, but you can address that again.
Yeah, I mean, they may not go away, but you can certainly improve your fibroid symptoms through diet modification, avoiding hormone-rich foods like red meat, non-organic chicken, dairy, eating more colored fruits and vegetables that have flavonoids in them. These are compounds that can block an important enzyme in estrogen production. Making sure your vitamin D level is adequate. Vitamin D has been shown in a number of studies to be the most powerful anti-fibroid growth hormone. It's technically not a vitamin, it's a hormone. So vitamin D, making sure that is normal and adequate is important. For those that like green tea, that's helpful. It's not as strong of a anti-fibroid growth element as vitamin D, but it does inhibit fibroid growth. So some people will drink green tea, they like green tea, and if you don't like the tea itself, you can buy the extract, which is the main ingredient of the green tea, over the counter. You can buy the extract. So there are things you can do with a diet, an appropriate diet, exercise, lose that excess body fat, like we talked about earlier, because estrogen is stored and produced in body fat. So there are a number of things that you can do, and if you can do them successfully, not only is it good for your fibroid health, but it's good for your overall cardiovascular
Thank you for
health.
that. Hey guys, I know we're at 9 o'clock already. Dr. Lipman, do you have a couple more minutes to continue? Fantastic. All right. Hey guys, thanks for joining. So I'm going to scroll down. All right. So we have a question from Fee.S. You mentioned holistic. Are there actual non-medical treatments for fibroids? I have a myomectomy 7 years ago and they grew back.
Well, remember, likely they didn't grow back. The ones that are there were there previously. They were smaller, but those were the ones that the surgeon didn't get out originally. So they really didn't grow back. They never left. They just got bigger, and when they got bigger, then they caused symptoms again. As far as non-surgical treatments for fibroids, I mean, UFE is an outstanding, completely non-surgical treatment for fibroids. It knocks out all the fibroids out. So typically, it's a one-time thing. You have the procedure once. It's an outpatient. You go home with a Band-Aid. There's about a 5-day recovery, and you get to 3 things, really. You get to the relief of symptoms. The success rate in my hands is a little bit over 90%. So it's a high rate of success, which is important. That's why the patients are coming to see you. Second, you avoid the risks and long recovery of an operation. That's really important. And third, you don't put your uterus at risk, because every myomectomy patient has to sign a piece of paper saying, we're going in for myomectomy, but you could wake up with hysterectomy. And that just doesn't happen with UFE.
And actually, looks like there was a follow-up question from her as well. Dr. Lipman, do you do pro bono UFEs? I'm asking for myself desperately. Oh, sounds like she needs to come to Fibroid Brunch.
We have in the past had an arrangement with Good Samaritan. We haven't had that recently, but in the past we've had a relationship with Good Sam. I know that there are places in Atlanta that get federal funding for treating patients that don't have means. We're a private practice. I don't have any federal grants like that, but for instance, Grady, and most hospitals that you go, I mean, they can't turn you away because you don't have means. We do take Medicaid. A lot of specialists don't take Medicaid. We do accept it, but for people that have absolutely no insurance, that's a much harder thing to help with.
All right, another question. Do you follow up with a post 6-month pelvic MRI? I had one that showed it worked. That's from Keisha. Oh, Keisha M again.
Our routine is 3 months. I like to see patients 3 months post-procedure and get the MRI. And the MRI is helpful. We ask patients, hopefully they say, yeah, my symptoms are a lot better. We go right down the list. How's the bleeding? How's the pain? How's the urinary frequency? Whatever symptoms that they're suffering or were suffering with, hopefully they're at least significantly better, if not completely resolved altogether. So we first check the patient's clinical symptoms to make sure they're better, and then we look at the MRI and hopefully see that all the fibroids are dead. Because if all the fibroids are dead and the patient can tell they're better, likely I'll never see them again, particularly if they're in their 40s. Because before they could ever grow any new ones, they would be in menopause. Now, sometimes we'll see patients that we've embolized in their 30s. Now they're in their 40s, maybe even 50s, and they didn't make it to, they didn't make it to menopause. They actually grew some new fibroids. But in that unusual circumstance, I would still say 2 UFEs is still way better than 1 surgery. Because we didn't talk about, what happens to women when they lose their uterus. I hear all the time, well, my doctor told me I'm not interested in children, so I don't need my uterus anymore. That's just absurd. And these are young women. These are women telling me this in their 30s or 40s, that they don't need their uterus anymore. That's absurd. Just because you're not interested in children does not mean you should lose an organ you were born with. It's likened to castration. There are women that suffer psychologically, like a man being castrated. There's sexual dysfunction, loss of libido, loss of orgasm, urinary leaking. Just look who's on the package of adult diapers. You would think it would be an elderly man or woman. No, it's an attractive woman of color, usually in her 30s. Why? Because the average age of hysterectomy is less than 40, and it's usually women of color who are undergoing hysterectomies for fibroids in their 30s or early 40s, and now they leak urine and need to wear diapers. It's absolutely tragic, and we need to stop it.
That's a t-shirt. It's absolutely tragic, and we need to stop it. So I'm going to go through some more questions here, guys. Dr. Lipman, you said something very quickly, briefly. You said about libido. Let me tell you how it is. Okay. My libido came back. Now, I didn't know that she had left. I just wasn't in the mood, but I didn't realize it. But when I tell you it came back, and I was like, oh my God. I almost forgot what I was missing because I was just kind of going through the motions. But I just want to ask.
Yeah, it's a common thing. I mean, when women are suffering with fibroids, sex often goes out the window. Why? For 2 reasons. One, they're usually bleeding significantly, having these, you were talking about all the different layers of gear that you were putting on. When you're wearing, period panties or adult diapers, you don't feel very sexual. So that's one reason. Second, you're losing all this blood that you can't possibly replace. So you're anemic, which means you're tired, fatigued, you're worn out. Just to get through the day is all you can do. And sex is exercise. And you don't want to exercise when you're significantly anemic. So when you're suffering with fibroids, sex is often discarded. But when you have your UFE procedure and now you're having light, normal periods, you can build up your iron and hemoglobin, and now you have the energy that you haven't had in months or years. You're not wearing all this crazy gear. You can wear sexy outfits. You feel more sexual. In fact, Cynthia Bailey, who was a patient of mine, I can mention this because she said this on her show, I gave her sexy back.
Well, look, you're getting my sexy back, and boy, I tell you, it's been amazing. I'm going to go to another question here. Hey, Jelly. So, Dr. Lipman, you mentioned vitamin D. Can you be a little bit more specific? Vitamin D or D3? Which one is preferred?
Well, it's vitamin D3. That's the active, but it's, you know, we're talking about the same thing, essentially. Vitamin D has to be converted to be active, and it's the active.
Fantastic. So, hey, guys, I see a lot of you guys are just joining. I've said this maybe 3 times. I'm going to say it again. Click that kite, that triangle thing, so your friends, family, and your loved ones can join us. I'm doing a fireside chat with the amazing Dr. Lipman of the Atlanta Fibroid Center. He's been performing uterine fibroid embolization for over 30 years. Now, the main reason why we're doing this is, of course, we want to educate you all on all options to overcome fibroids. But again, we are having our 2nd annual Run Far 5K Run Walk. It's a 2-day event in Atlanta. Friday, July 14th is going to be a fibroid brunch, which is a discussion with experts in the womb reproductive space. Day 2, Saturday, July 15th, is going to be the 5K Run Walk. Run Far 5K. FAR is an acronym for Fibroid Awareness and Resources. Click the link in my bio and let's run FAR together. Going to go through a couple more questions, guys. We've been on since 8 o'clock, maybe 8:05. Probably another 10 minutes. You thinking, Dr. Lipman? Talk for another 100 hours. Fine. But all right, let's go to. Let me scroll down. Okay, here we are. Another question from my pumpkin 18. Does UFE procedure reduce the pain when having sex? Because sometimes it can be painful pressure experience. Yes, it does.
I would say absolutely yes. I mean, oftentimes sex is painful because there are fibroids that are near the cervix. And once the UFE procedure is done, all the fibroids are knocked out, including those. And so sex is, you know, not painful any longer. So it's one of the questions we ask patients, because we want to know about that. But yes, sex is if sex is painful prior to UFE, it's often not painful.
And one thing I want to add to that is actually I did a podcast a couple ago, which I'll be posting soon. But fibroids and sex, it's very difficult. Number one, it's very difficult for the woman to realize what her body's going through because we're such an autopilot working, fending for the children, our family, cooking, cleaning, and we leave nothing in the tank for ourselves. So to your point, having sex, that's like a chore. It's exercise, right? One thing that I have found though, so for those of you who are still going through your fibroid healing journey, is that when it comes to sexual intercourse, 2 things. Number one, I find the spoon method helped me. So when my fibroids were at its worst, the spoon method helped me because that kind of control him from going so deep. But secondly, being on top, and I know this is a sex conversation, but hey, we're all adults here, right? But being on top, and that can actually get him to be even deeper. But what I like best is that allowed me to control it. So I knew how to control the depth of it. So just wanted to kind of add that. I know that wasn't quite her question, but wanted to just add that a little bit too. All right. Oh, same person. I live in New York. Would I be able to do the procedure in Georgia, and how would I request that through my insurance? I don't trust anyone. I get it. I do. I get it.
We see patients from all over, including New York. It's always best if there's friends or family that people can stay with, but if it, you know, oftentimes patients will come with their significant other and stay in a hotel. So yes, it can be done. We would get imaging. MRI, as I mentioned earlier, is the gold standard of imaging, and we'll see the patient remotely in like what's called a teleconsult. It's a HIPAA compliant, secure consultation where we go through, it's usually about 45 minutes long. It's pretty extensive, where we go through all the symptoms, what the patient's going through, and then go over the MRI images. And so she can see all of her pictures through this, teleconsult. And then we talk about options. And if the option is UFE and it seems to be the best option or the one that the patient is most interested in, we're happy to try to help.
Let's talk about that. Two things. Number one, about insurance. I've been doing insurance for 23 years. I'm an employee benefits consultant. And yes, you may be able to have the procedure here in Georgia with Dr. Lipman. The main thing is making sure you understand how your insurance works. So you want to make sure that you have an open access point of service, open access POS, or either a PPO plan. That will likely increase the odds of Dr. Lipman being in network. So you can use your insurance, the main thing you want to maximize your coverage, maximize your benefits. So if you call Dr. Lipman's office and say, hey, do you take out healthcare or Blue Cross? They're probably going to tell you yes, and they are. But the main thing you want to do as a covered member who has insurance, you want to make sure you reach out to your insurance company and you're verifying if Dr. Lipman is in their network. Is he a contracted doctor? Is he participating? Because that gives you, for lack of better words, gives you more bang for your buck. Your benefits go for better coverage. Whereas if you're playing, if he's out of network, you're going to have more out-of-pocket exposure, more out-of-pocket. So you can send me a quick DM. I normally don't go into details because of HIPAA privacy and all that. But if you want to send me a quick DM, I can talk to you for about 2 minutes to talk. I'm not even going to charge a consultation for. I'll be happy to talk to you about how to make sure you're coordinating that with your insurance. So,
yeah, my office staff is really good at that. And so we'll actually, the patient often will either send us or text us, a picture of the front and back of their insurance card. And one of the outstanding ladies in my front office can actually tell the patient, based on, the benefits that they have, what their expected, if any, out-of-pocket is. Am I in network or not? And sometimes, even if I'm out of network, sometimes if there's not an expert in their area that does UFE, some insurance plans will allow in-network benefits for an out-of-network provider like myself. So it is rather complicated, but my office is so used to dealing with this. They are experts and they can look the patient's insurance information up and tell them, because it's hard for the patient to navigate this, and that's why we like to help patients, and we're very, very good at it. So it's just another reason to work with
right.
us.
Your doctor's office is amazing when it comes to stuff like that. I mean, you guys were able to verify my insurance, even though I knew it myself, but just to know I had that extra layer was very comforting. This is the same one? I'm sorry, I think I already listed this question. And I know there's several more questions. I'm trying to get to everybody. Let's see, we have one from Sleepy Lioness. Hey, Lioness. I got a CESA done, and the 7-centimeter fibroid I hoped would go away has come back. What are the next?
Yeah, that unfortunately, I hope they didn't tell you it was going to go away, because that's just not realistic. Excessa, for those that don't know what that is, it's a laparoscopic procedure. So it's surgical. It's done under laparoscopic surgery. And they stick a probe into a fibroid and try to cook it. And so it's not a very good procedure, unfortunately, and it has a number of drawbacks. One is, most people don't have one fibroid. They may have one dominant one, perhaps, and it sounds like this woman may have this one dominant fibroid, but usually the vast majority of people have a lot more fibroids that are problematic than just one. And 7-centimeter fibroid, that's the size of a tangerine. And to cook a 7-centimeter fibroid is not an easy thing to do. And usually, we've seen numerous Excessa failures. And so I guess I'm biased against Excessa because I see all their failures and they're common, because it just basically kind of punches a hole in the fibroid. It doesn't treat the entire fibroid, and certainly the fibroid doesn't go away. If they told you that, that was, very, very misleading. That doesn't occur. we treat a lot of the excessive failures because excess is a very local solution for typically a global problem. There's usually a lot more fibroids than a woman, than they can do by sticking probes in there. UFE knocks all the fibroids out. So you need a global solution, not a local one. But, Excessa is kind of newer to the scene, and doctors like to play with new things. It's like the new shiny object, and patients have to be wary of, the new shiny object. UFE has been around for 25 years or more. It has a long track record of safety and efficacy. Excessa's, not been around very long, and just to punch a hole because the surgeon doesn't want to do regular surgery or offer UFE to you is
so what would be her next steps?
Learn about the Atlanta Fibroid Center. If she's having symptoms, she needs to see someone regarding her fibroids. We'd be happy to see her. Or if she, wants, it's an interventional radiologist, either myself or someone like myself, that has a lot of experience treating women with fibroids. So we're happy to see her if she would like, but that's what I would suggest she get another opinion about UFE, because I would bet that she never heard about UFE before her Excessa. If she did, she probably, it wasn't, given its due.
Awesome. So reach out to Atlanta Fibroid Center and schedule a consultation. I
guess I could tell people how to reach us. I mean, we have a website, which is very helpful. That's atlii.com. atlii.com has a lot of information. You can see what we're doing in the community. You can see all sorts of information about fibroids, about the UFE procedure. Also, people like watching. They say, can I watch a UFE procedure? We videoed an entire UFE procedure, and I talked through the whole thing, each step by step. So it's about a 35-minute YouTube video. So our YouTube channel is Atlanta Fibroid Center. So if you go on YouTube, Atlanta Fibroid Center, you can actually watch a entire UFE procedure from beginning to end, as well as there are over 200 videes on fibroids, on the UFE procedure,
now,
all sorts of good information there.
And I'm glad you said that. I didn't know that you actually filmed the UFE procedure. I would actually love to see it myself. I know I'm kind of weird, guys, but I get intrigued with stuff like that. There are probably maybe 10 more questions in our question box. We're going to try to get through them as much as possible. I have one here from, I hope I pronounced it correctly, Rama KG28. Can you have children after UFE?
Absolutely, yes. But again, it's important to see an interventional radiologist like myself that has a lot of experience in UFE. But yes, we've had numerous children after UFE. The births are typically full-term and vaginal, whereas if you have a myomectomy, you will not be allowed to have a vaginal birth. And so I'm not saying everybody should get UFE. We look at the patients individually. Some patients we say are better served with UFE. Some patients we say are better served with myomectomy. It really depends on how big and how many of your fibroids that you have by MRI, not ultrasound. Ultrasound is not good enough. It's how big and how many of fibroids you have by MRI, how old you are, if you've ever had previous myomectomy. No one should have more than one myomectomy. So if you've ever had a myomectomy, the next time you have a problem with fibroids should always be UFE.
So
in my
two
opinion.
things. Who's considered like your ideal patient? And I just see one comment here, which I'm glad I saw it. Miss Kiara, what are your recommendations if UFE did not work for large fibroid, 10 centimeters?
I don't know why it didn't work. I mean, the vast majority of patients, no matter what size they are, 10 centimeters is large, but the success for 10 centimeter fibroids is every bit as good as it is for 5 centimeter fibroids. So it really depends on why didn't the UFE work. Some people go to inexperienced operators, and so they may not successfully embolize both uterine arteries. Sometimes patients have a secondary blood supply that feeds the fibroid. So you knock out the uterine supply, but if they have an ovarian supply that's feeding the fibroids, in a woman that's interested in fertility, you got to leave the ovarian supply alone. And the more the ovarian supply the fibroid, the less symptom improvement there is. So you have to go to, I would suggest seeing the IR that did the UFE procedure, see them in follow-up, ask these questions. Hopefully they got an MRI with contrast to see, are all the fibroids dead or not? If that 10-centimeter fibroid is not dead and they embolize the uterine branches, if a woman is not interested in fertility, they could go back and do an ovarian embolization. And so there are ways to fix it, if you will, but it really depends on why it didn't work. And fortunately, the number of patients it doesn't work in is very unusual, which is great. The success of UFE is a little bit over 90%.
And who's considered your ideal patient?
I'd say the ideal patient is someone that has multiple fibroids that are, in the 5 or 6, 7 centimeter range. They have multiple smaller fibroids that are causing significant symptoms. They have a uterus that's no bigger than, it doesn't go above their belly button. That's ideal. So you get like a 12 to 16 week uterine size with multiple small fibroids causing problems in a woman that's not interested in fertility. That's a very ideal candidate for UFE.
Okay, awesome. We have several more questions, guys. I'm going to give us, it's almost 9:30. This is very...
Yeah, we should probably have a 9:30 hard
this
stop.
has been a very interesting conversation, guys. If we don't get to your questions, my apologies. Feel free to send me a DM. Actually, what I'll do, I'll post in my stories, ask me a question, and what I can do is funnel that through Dr. Lipman's office and we can get back to you.
Yeah, sure.
One more question after this, and then we're done. Did you already talk about having a baby and the risks after UFE? How long after UFE can one try for a baby?
Well, we tell patients that we want to see them in 3-month follow-up. We want to see what things look like. And if everything looks good, then we give them the thumbs up and say, whenever it's on your timetable to try, then start trying. Occasionally, we'll see some patients that have some residual fibroids. They're dead fibroids, but they're close enough to the cavity where, their physical presence, even though they're dead, their physical presence might impede fertility somewhat. So we tell them, give it a few more months. If you can give it 2 or 3 more months and have these fibroids shrink even more away from the uterine lining and the uterine cavity, because that's where the action is. We don't care about dead fibroids out in the periphery. So we talk about the prime time area is downtown. Right. We don't care what's going on in the suburbs. So we look at the downtown area around the cavity of the uterus next to the lining, because that's where implantation takes place. That's where the action is. And so sometimes we say, give it a few more months, get these fibroids even further out of your way. But I'd say most patients, we just say after the 3-month visit, yeah, if you're interested.
Fantastic. Last question, and I'm so sorry, guys. We've been going for an hour and a half. Again, send me a DM, or better yet, I'm going to post in my stories, ask me a question, and I will funnel it through Dr. Lipman's office. Let me see here. Trying to go to the question here. All right, here's the last question from Naturally Ali Sam. I've had 1 myomectomy 5 years ago and 2 UFE procedures about a year ago. Wow. My husband has been trying to conceive for over 3 years. Not sure what to do next. Any suggestions? Oh, Lord, I'm so sorry.
Yeah, I mean, hopefully your fibroid symptoms are over with, particularly after having all the stuff that you've had. Hopefully you're not having any fibroid issues as far as symptoms. It's just a fertility issue. And unfortunately, fertility is, it's a very complicated thing. There are many things that have to be right for you to be successfully pregnant. And so it's impossible for me to know, I would go to a fertility person that has experience seeing patients with UFE. A number of fertility doctors don't have that experience, and they'll just say, well, you know, you shouldn't have had UFE if you were interested in children, and that's just absurd. But there are, I've heard, you know, reproductive people say that, and they fail to realize that every time you cut on the uterus surgically, your fertility drops like a stone. So, you know, the fertility is every bit as good after UFE as it is for myomectomy. There are numerous studies showing that. In fact, we looked at our population, 60% of the patients that wanted children got children, which is remarkable because our patients that are interested in fertility are typically between 35 and 45. So they are, quote, older women. They're not 20-somethings. You know, and a lot of fertility trials compare us against, you know, 20s and 30-year-olds. Also, you know, because with age, fertility diminishes. So our patients are, you know, tend to be older. And also a number of our patients have already had a myomectomy, like this woman. And so if you've had a myomectomy, your fertility is significantly lower. You know, after one myomectomy, about 50%. After two myomectomies, about 10%. And so, you know, it's a complicated issue. I would go to a reproductive endocrinologist that at least has some expertise seeing patients that have had UFE. Here in Atlanta, I can't say enough good things about Dr. Toledo. So Andrew Toledo from Reproductive Biology Associates, RBA in Atlanta, he's the man. So I would recommend him. If you're not in Atlanta, I don't have any other names to throw out, but it's a difficult issue.
Thank you for that, Dr. Lipman. It's always amazing chatting with you. Everybody, for starters, yes, this live is going to be saved. Secondly, follow Dr. Lipman. You know, check out the Atlanta Fibroid Center. Reach out to their office here in Atlanta. Schedule consultation. It's not, you're going to feel like you're being treated with the utmost respect, utmost privacy. They treat you like you're at a spa, basically. Next, we are having, lastly, last time saying this, we're having our second annual Run FAR 5K Run Walk. FAR is an acronym for Fibroid Awareness and Resources. Everybody on this live should be registering. I thought of everything. You could do it in person. You can do it virtual. You can gift the registration to somebody else. You can sponsor. We're looking for sponsors. Sponsorship packages start at $150. And Dr. Lipman, their office is a sponsor. We're so tremendously grateful. So FAR is an acronym for Fibroid Awareness and Resources. It's a 2-day event. Friday, July 14th is the Fibroid Brunch. Dr. Lipman's office is going to be there. It's going to be a panel discussion of over 10 experts in reproductive, womb wellness, mental health, so on and so forth. Day 2 is going to be the 5K run walk. You guys see the pink ribbon outside. You already know what the pink ribbon stands for, breast cancer. Our goal is to make Run FAR 5K as well known as Susan G. Komen Walk for Breast Cancer. Obviously, there's dozens and hundreds of thousands and millions of women across the globe who suffer from fibroids. And if I can leave the face of the earth knowing that I have impacted and made a difference, and I will tremendously succeed. Thank you guys so very much. This has been an hour-and-a-half conversation. Dr. Lipman, I love you. You're amazing. Keep doing what you're doing. We truly will. And you guys give me about 5 minutes and the live will be saved. Thanks so much. Have a great one. Kudos.
Thanks.
You too.
Have a good evening. Bye-bye.